Hey, good afternoon. This is Dr. Thomas Dobbs, the State Department of Health. Can everyone hear me okay? Dr. Byers, can you hear me fine? Very good. So it is now 1:01, so we'll go ahead and get started. Um, we've seen a lot of activity in the coronavirus realm over the past week. We've seen some pretty significant increase in cases. I would hope that this is not any major surprise to anyone because we know what causes coronavirus. We know what spreads it. We know what measures can be used to mitigate it. And sadly, we've seen a softening of our communal resolve to do what it takes to prevent coronavirus transmission. So with that, I'll go ahead and turn it over to Dr. Byers to kind of give you guys a review of some of the numbers, and then I'll talk a little bit about our hospital status. Dr. Byers, if you'd go ahead.
Absolutely, and I'm trying to unmute myself, and I wanted to share my screen because I did want to show you all some pertinent data, and I'm not going to enlarge that, so I hope that y'all can see it and that y'all are hearing me well. Good afternoon. And again, thank y'all for this opportunity to speak with you about what's going on and to give a current update. As you can see over the past several weeks, and this is our epidemiology curve that we post on our website, and it's actually a good indication of what is occurring in our case counts because it demonstrates those cases by when the cases actually occurred and when the event occurred. And you can see that over these past couple of weeks, we've started to have some significant increases in the number of cases that we've been reporting and some significant rise in that slope. So today we are reporting over 1,000 cases. Yesterday we reported over 1,300 cases. We're not reporting as many deaths on a daily basis as we have been, but if you look at the next graph, which is the epi curve of deaths by date of death, you can see that it's beginning to level off and that we are possibly making a turn up now. And that's predictable because often, and we've seen this, the spikes that we've had previously, that when we have an increase in cases, usually a couple of weeks after those increases, we start to see some increases in deaths as well. If you look at our COVID-like illness monitoring system, and this basically is emergency department data from hospitals and clinics throughout the state that report COVID-like illnesses to the Department of Health electronically. And you can see that we're starting to have an upswing in our COVID-like illness as well. So we are seeing a number of indicators that are demonstrating that we are starting to see some increases now. And, you know, if we look over the last week, we do have a number of counties that are starting to have some significant increases in the number of cases. When you look at the transmission dynamics that are occurring, we are still seeing cases in long-term care settings. And in some counties, we are starting to see the 65 and older as our fastest growing age group. That data is posted on our website by county. We're also seeing some growth in the 50 to 64-year-old age group. That's concerning because we know that those individuals are at highest risk. When you look at our data for deaths and the age groups where most impacted by COVID-19, you see that most of those deaths do occur in folks over the age of 50, over the age of 65. So that's a concerning development. When you look overall statewide, however, our fastest growing population is now the 5-year-old to 17-year-old age group. And that's the elementary school age group. So, you know, we are seeing outbreaks in long-term care settings. We are seeing outbreaks in some other congregate settings like correctional facilities. But we are also seeing a lot of transmission outside of those large outbreak settings. More of the very small transmission events that occur person to person, like in your home, or with small groups or small gatherings. We are hearing more about parties and parades that are being had without wearing masks. And, this is concerning. We have looked, and y'all all know from national data that percent positivity of tests has often been a good indicator of when we are starting to see an upswing in our cases. And if you look at our percent positive for Mississippi for the last week of September, we were at 8.5% positivity rate. And for the first week of October, we're looking at 9.5% positivity rate. So we are starting to see some increases in our positivity rate. We do have those published by county on our website, so I would encourage you to look at those as well. But all indicators are that we are in the midst of potentially another very large increase in the number of cases, and with the regrettable outcomes of an increase in the number of deaths. I think that was everything for me, Dr. Dobbs.
Thank you, Dr. Byers. And one of the things that we've been very concerned about is coronavirus overwhelming the healthcare system, and certainly as we go into this new surge of coronavirus infection, and we're looking into the flu season rapidly approaching, we are gravely concerned that healthcare resources are going to be overly taxed. Presently, we have 146 COVID patients in the intensive care unit. We have 75 on ventilators and a total of 482 COVID patients in medical surgical situations. We are currently at 18% ICU capacity across the state, which in and of itself is not that bad, but we're going into this COVID growth phase with very little reserve capacity. So we will watch this very closely. We've been communicating with hospitals, trying to make sure that they understand where we are, the seriousness of the situation that may unfold over the next several weeks, especially as we see the rapid growth of cases in over 50 and over 65, because these are people who are more likely to be hospitalized. If we look at how many ICUs have less capacity, we have 12 in Mississippi that have less than 10% or less ICU capacity, and we have 6 that have no ICU capacity. 2 of those are in the Jackson metro area. If we look at people who are hospitalized, we just want to really reiterate how deadly this virus is. I know there's been some advancement in our capacity to treat folks. We know that we have the use of steroids for people at a certain phase of illness. We also have remdesivir as an antiviral, and it looks like it is helpful for mortality, but the mortality benefit we're seeing is modest if you look at the number of people who go in the hospital and then die. It's going to be around still 10, 11% of folks, even in some of these study scenarios where you're getting optimal care, are going to die from coronavirus once you go in the hospital. So there is still a very high risk of death from people when they get coronavirus and they have to be hospitalized. So as we go forward, a couple of things that really just want to ask with all sincerity to please go ahead and let's take action now. Go ahead and make sure that we reinforce those social distancing efforts we know that are effective, especially social events. Indoor social events are what's driving the transmission of coronavirus in Mississippi. So we would advocate for people not having indoor social events. If you're going to do something, do it outdoors. Otherwise, would recommend not doing it at all. Even if you're going out to eat, outdoors is safer, so would recommend outdoor or takeaway is a better way to go. But of course, we want to also advocate for maintaining that social distance, that minimum 6 feet, and we know masks are so important. So we'd like to strongly encourage everyone to continue mask utilization. I've been in close communications with the governor and his staff, and I know that he's extremely concerned. And so we would expect that there may be some additional action taken from his office in the early part of next week. We will continue to keep him updated so that we can make the best decisions going forward. A couple of things I would like to just touch on really quickly: testing and contact tracing. Right now, we have widely available testing with quick turnarounds, and want to really encourage people to take advantage of that, especially if you have any symptoms of coronavirus or if you have been exposed or think you might have been exposed. We are offering rapid testing at the Jackson location, but also the Tupelo location today. But next week, we plan to offer rapid testing for everyone who is symptomatic or is a known contact or exposure to a case throughout the state, in every county through our normal drive-through operation. So please take advantage of that. It's free, it's available, it's fast, it's easy, it's the front of the nose, it's not very uncomfortable. I promise it's way easier than it was previously. So please take advantage of that testing. As far as contact investigations go, we are up to 100% capacity right now. So we are able to reach out and do a case investigation and contact tracing around every case from the Department of Health staff and our reinforcements that we brought in the fall. One of the things that's important to understand about that is even though we have full availability of testing and 100% contact tracing, we're still having an explosion of cases. So what does that tell you is that we're missing a very critical piece, and that critical piece is the social distancing and the masking piece. And so we really, really need the public, businesses, churches, everyone to engage and understand the seriousness of our current situation and do those simple things, small groups, outdoors only, avoid social events, a mask, and 6 feet. That's all I have. Dr. Byers, anything else before we open it up for questions?
Just one thing that you did mention, and I have to tell y'all that we are also starting to see some increased clusters associated with churches or attending church. And largely when folks are attending church in groups where they're not taking proper precautions, and that's a concern as well.
So I'll go ahead and start pulling some of the questions down from the chat. Let's see. I'll start from the very beginning. Here's a question from Nick Juden. 2 weeks ago, when the governor lifted the statewide mask mandate, you and Governor Reeves assured me that Mississippi's virus response strategy would adapt rapidly if the circumstances changed. Clearly, we're in the early stages of what could be a third spike. What's changing to arrest these numbers, and how quickly will that new strategy be put in place? Specifically, executive orders or guidelines are forthcoming. I've been talking closely with the governor and his team. We'll have further conversations today. I would expect something to happen early next week, but we will continue to make sure that he has all the information that he needs to make the best decision. Of course, we'll continue to advocate for the things that we know are effective and are going to be useful in slowing down the spread of this virus. We're also working very closely with our hospitals to make sure that they're as prepared as possible. There's a question from Ashton Pittman from Mississippi Free Press. Early on in this pandemic, Black Mississippians accounted for 60 to 70% of cases and deaths, but that trend has reversed, and we saw white Mississippians surpass Black Mississippians in deaths last month, and then in cases October 14th, and it appears cases are growing at twice the rate among white Mississippians as Black Mississippians. What do you take away from this dramatic reversal, and do you have any evidence for why we've seen this trend reversal? That's a really great question. I think there's a lot of things that are at play here. Some of it is going to be more qualitative in answer. One of the things that sort of moderated the mortality early on was when we started seeing more cases within the nursing homes, and there is a larger proportion of white folks in the nursing home than Black folks, which, the population in the nursing home pretty much mirrors the population in the general population. So with the additional deaths in the nursing homes, it did sort of equilibrate more when we saw the number of deaths. As far as the case trends, we have had really pretty good uptake by a lot of folks in the Black community with masking and social distancing. We've worked very aggressively to make sure that the Black community understands where the risks are and what can be done to prevent that. And I just will say, I think big parts of the white community, especially in areas that maybe weren't as hard affected, have not been as compliant or engaged actively with social distancing and masking, and I think that does make a difference. You said, this is from Kingfish, you said that the fastest growing group is school children. How many of them are actually winding up in the hospital since school reopened? Dr. Byers, I don't know if you have that. I don't have that at my fingertips, but there have been some children hospitalized. Dr. Byers,
Yeah, really total, we have not seen a whole lot of hospitalization in school age or K-12 age kids. So far, we have 58 hospitalizations. But as you can imagine, when we start seeing increased cases in any group, that does increase the risk of, or the chances that we're going to see some of those with severe infection. And we're going to see some that are hospitalized. And you know that, and we post this on our website, the number of cases that we see in children 18 and under who have multi-system inflammatory syndrome. And those by and large require hospitalization. And those are children who are 18 and under. And we have seen deaths in at least two individuals less than 18. So, you know, the severity of illness and the severity of outcomes are more infrequent in kids, but we do see it. And it does worry me that the more cases that we have in that particular age group, the more chances we are going to have for severe outcomes.
And we have a question from Jerry Mitchell. Are you recommending a mask mandate? That's a great question. And I'll tell you, whatever it takes to get maximum mask utilization and engagement from the populace is certainly what we recommend. I will say that since the mandate was rescinded, people have not maintained mask behavior like I had hoped, honestly. We have seen a lot of businesses, other organizations have not taken the successes we gained from the summer and translated them into ongoing action. There probably will need to be some degree of more aggressive action. Certainly, you know, however that is rolled out from a statewide perspective is going to be up to the governor and his folks, and certainly on local level, I think it's a good idea and would continue to support local government doing a mask mandate. So, you know, basically, you know, whatever it takes to get as many people using masks in public spaces, especially indoors, we're all for that. Steve Gagliano from News Mississippi. Dr. Dobbs, back in July, you stated that for every 1,000 new COVID-19 cases, we can expect around 170 hospitalizations. Is that still the expectation? You know, it's going to change a lot depending on the age group who is affected. And, you know, recently we've had more kids, but as we transition more into older folks getting it, I think that's a reasonable expectation for hospitalizations. Now, we're a little bit better about keeping people out of the ICU, I do believe. So it may well be that the number of folks percentage-wise who go into intensive care may be a little bit lower. At least I would hope so. But I do think that may be a reasonable estimate once we sort of have some balance in the population. It's sort of the same thing we saw in the summer, right? We had young folks who were getting sick, and then there was this, you know, magical belief that it didn't kill people anymore, but it just took time to go deeper into the population, those who are older and those who were sicker, and then we started filling up the hospital, and then our death rate climbed remarkably. And I'm very fearful and suspect that in many ways we're going to follow that same pattern. Tom Garman, what do you see in college towns, and are some towns at reasonable risk of having students sent home? You know, we are seeing some pretty significant increase in cases, especially in the Hattiesburg area. We have seen quite a lot of cases from Southern. You know, we had pretty big spikes early on at State and Ole Miss, and those have sort of settled down more or less. Certainly, we do worry about kids going home if they're infected or quarantined. We've seen that happen time and again. From my personal observation of the cases that I've been involved with, at least if kids go home, the parents do have some awareness that they're at risk. And the ones that I've seen, they've taken some measures to prevent transmission, you know, having the person stay in another room, maybe a different part of the house where that's possible. Certainly, it's better not to bring the virus back home if you can help it. But if you do go home, make sure you maintain that distancing, wear a mask, and stay away as much as you can. The bigger challenge is going to be, I think, in high schools and stuff like that, where people live at home all the time and they're sick and contagious before they even know that they have been exposed or maybe going to be contagious. For Dr. Byers from NBC News, You mentioned the state holding testing events, which result in higher incidence of testing and testing numbers. How often are these events held? For how long have they been going on for? I'm not quite sure what that statement was, Dr. Byers.
Yeah, so, we've been having testing events and we have testing available in all counties, at least one day a week. And certainly we're going to have more broad availability of testing at the county level coming up. And so, we've also done some testing events. We've done some targeted or focused testing that's been in higher incidence areas. So, there is really more broad availability for testing throughout the state, not only at the county health department, but testing at primary care physicians, at hospitals. Certainly we have a lot of testing going on in long-term care facilities. We do a lot of testing around outbreaks to support congregate settings for determining who's infected and who may need to be excluded or who may need to be quarantined. And really that's been going on for several months now that we continue to do that. Watching our numbers that we report on our website regarding the total number of tests that are done, often that is related to when those tests are actually reported to us. The most reliable numbers that we have are through electronic lab reporting. And, but it's difficult at times to determine a daily total of tests just based on what we report on our website, because that can often be, very subject to when we get a large data dump from a lab or a hospital that does occur periodically. As far as testing practices or testing behaviors over the last several months, what we often see, and we have seen certainly a decline in people coming to get tested, and certainly we know that a lot of that is driven for when folks are symptomatic. And the more symptomatic folks, and as we move into this upswing of cases recently, I think that we're going to have more demand for testing coming up as well.
Yeah, and that sort of gets to the second part of the question. What have you noticed about testing behaviors in the last 2 weeks? Are they different from the start of testing 8 months ago? And I don't know, Paul, if you have any. I mean, people are less scared as far as like demanding tests early on. The supply is more than demand at present. What would you add, Paul?
And I would think, when we looked at our summer testing, when we were starting to go into those big upswings at that point, I mean, the demand for testing was very high from both people who were exposed, people who were worried about being infected, and people who were symptomatic. And as we went through that lull in the summer, a lot of the interest for testing dropped off, even among exposed people that who were recommended to get tested. We still saw some drop-offs in testing, testing is an important piece of the puzzle. It's not the only piece, but it is an important piece. And certainly, we recommend folks who are exposed or symptomatic certainly come get tested. I think that's important, but that has changed, and it does seem to follow the upswings and the ups and downs of cases.
We have a question from Jade Bilexa, WJTV. How safe are upcoming events like Mistletoe Marketplace, even with precautions taken? There's several components that are worth sort of unpacking. Certainly, the higher the baseline transmission is in the community, the higher the risk is for everything. So, if transmission is really high, it becomes much less safe. As far as like operations, it is an indoor type event, but it is a big facility, quite spacious. And, we know that if people are wearing masks, and my understanding is on their current planning, there's mandatory masks, and would absolutely endorse, encourage, and support that. Maintaining proper spacing, hand hygiene, all those sorts of things can probably be done relatively safely. But again, it's making sure that we're masking, maintaining distance, good ventilation. Indoors always does worry us somewhat. I would always recommend people at high risk, especially, be extra cautious and consider not doing things. But, as the pandemic continues to roll through Mississippi and look at our case numbers, I think that that's going to affect what we are able to do, whether it's mistletoe or other things. And so, we want to do stuff, right? But we haven't demonstrated the discipline to maintain the capacity to do things because we're wasting our chances on silly things that are not that important to us. Well, at least, it's certainly undermining our long-term prospects. Dr. Byers, anything you want to add to that? Okay. Oh, from Kobe Vance, MPB News, Dr. Dobbs, you tweeted earlier that it's hard to prevent transmission in an unstructured setting. What does a properly structured setting look like, and how does it slow the spread? And that tweet was related to a recent CDC report talking about an outbreak in a hockey team. They had 22 folks on there, one infected person, and of the 22 people from the hockey game, 14 people got it, right? So when you have people moving around, interfacing, can't maintain space, breathing hard, even in an athletic event like hockey, you can have a super spreader event. It's just the way the virus operates. So that's the example of an unstructured setting. And that also has very clear parallels to youth sports, right? Or even SEC sports, which we've seen some issues. A structured setting, which we've seen in schools, is if kids are seated in regular locations where they are, they're wearing masks, they're maintaining some distance, 6 feet optimal, but even a lesser amount is helpful. And the teacher's wearing masks, and there's not a lot of random interface. We haven't seen a whole lot of transmission related to that structured setting where people are wearing masks. In contrast to unstructured settings in school environments where either it's a social event or an extracurricular event is really where we're seeing a lot of transmission, and that's going to be the key difference. This is Keisha Rowe from Clarion Ledger. Recently, Summerall High School had to quarantine the entire student population due to COVID exposure. Southern Miss also had to cancel their game because there was a spike in cases in the program. I know schools had to submit COVID. I know schools had to submit COVID response programs to keep students safe. My question is, what's not working, and is there anything that can be done to curb the spread in schools? It's not in the schools. It's social stuff. And a lot of it's endorsed by parents. So we need to be careful. A social, unstructured environment without a mask is where we're seeing the spread drive. In the schools, by and large, we've been very impressed by the planning that's been undertaken. In the colleges and at Southern, when we went and met with them and looked at their on-campus prevention plans, they were fantastic. It's off-campus, unstructured, social stuff that's really driving both of those sort of situations. And then when you have it that bad, you just got to quarantine everybody just to keep it from getting out of control and then spreading within other parts of the organization. CJ Lemaster with WLBT. I want to ask whether any spikes have been tied to the state fair as of yet. Yesterday, we saw the most cases in more than 6 weeks in Hinds, Madison, and Rankin counties, which hit 8 days after the state fair opened. And this large event isn't to blame for these substantial upticks in metro counties. What is causing it? Dr. Byers, I know we are monitoring closely, trying to see if we've seen cases that have been attributable to the fair or any outbreaks in the fair. And to my knowledge, thus far, we are not aware of any outbreaks related to fair attendance, although it's still kind of early.
Yeah, I think we're still early in the game. We haven't identified any that we know of that are directly associated with the fair or attendance to the fair. But that is something that we're looking for. And we may see that over the next couple of weeks if you think about the incubation period.
And if we look at what's to blame for it, I think it's death by 1,000 cuts. It's a whole bunch of everything. It's social events, it's extracurriculars, it's people abandoning masks in large numbers. It's the same stuff we saw before. There's no specific thing. It's just a lot of little stuff that we're seeing. And a lot of it's family spread. And that's one of the things that's so challenging, or within intimate friend groups where you really see the sort of the expansion and the risk being very, very high. On the illness onset chart, do we know what percent of those over 2,000 comprising cases over the last 2 days are actually illness onset versus date tested or reported to MSDH? As we investigate them, we do move them onto the date of onset, and you'll notice it sort of shift over time. But I think the majority of those have happened within the past few days or past week or so. Dr. Byers, would you
they have, and if as we investigate the cases, if we find out additional information that is either the exact date of onset or the exact date of testing, that information that we may not have had in the original report, then we will move those cases to the appropriate date. But when you look at our chart, the majority of those cases that we've reported out are cases that have occurred within the last few days.
Thank you, Dr. Byers. So from Nick Juden, if we continue at our current pace, Mississippians will go to the polling places at peak spread of the virus thus far. There will be no protections against droplet spread at Mississippi polling places. What is MSDH doing in recommending to protect voters? Is a packed polling station safe under the oncoming conditions? Yeah, boy, that's a fantastic question, and it's something that worries us a lot. The mechanisms of transmission are the same no matter what the circumstance is, right? So indoors, crowded, not wearing a mask. So a couple of pieces to that. Certainly we want to do everything within our authority to do what we can to prevent transmission. And so one of the simple things that we've done is we are providing masks with face protection, medical surgical masks with a face shield to protect voters who are over 65 who have certain chronic medical conditions that put them at high risk, to offer an added level of protection. Is it perfect? No. Is it something else that we can do for folks? Absolutely. It's what would happen if we had a healthcare professional visiting in a clinical scenario as a basic level of protection. We advocate for masking indoors, and I know that there has been some conversation that maybe that is or maybe that is not allowable to have mandatory masks within polling places. But if it would be allowable, anything that will improve and enhance the percentage and number of people in a polling place using masks, we would support that. And also, making time. I mean, that part of that is, is we can separate it as much as possible, but a lot of that's going to be outside of our purview. In talking about an announcement from, this is from WLOX, Dave Elliott, in talking about an announcement from the governor next week, are you considering mask mandates in certain areas rather than statewide as you did before? Perhaps in areas like Harrison and Jackson counties where numbers are much higher than they've been since early August. To be honest, I don't really know what the governor's going to do until it happens. And a lot of times I learn the details when we sit down together at the press conference. I do know that, Jackson, Harrison County, some other places that have high rates, if we did go back to that sort of approach, I think that they would be prime candidates for that type of intervention. From Jade, again, college students will be returning home at Thanksgiving and not returning to college campus until January. Should they be tested before leaving school so parents can be made aware of their status before returning home? We certainly would be happy for people to get tested, but there is still this fallacy that testing can protect folks. Obviously, it didn't work out well for the White House. It hasn't worked out well for SEC or professional sports. There's gaps from testing, and the best thing to do are going to be social distance and maintain separation and assume that anyone you're around has coronavirus. There is, and the other thing with the rapid tests, and we've seen this, and this is not surprising, is that if you have a rapid test, it's best for people who are symptomatic. And if you're asymptomatic and just getting a rapid test, it's most likely going to be negative, and there's a significant chance you'll get a false negative because the viral load hasn't really ramped up enough to trigger the rapid test. So, could there be some modest utility? Perhaps, but certainly it's not going to be a panacea under any circumstances.
Dr. Dobbs, I would add to that too that testing can give you a false sense of security because you can test negative on one day and the following days become infectious, and you can't really rely on that totally. It's not wrong to test, and certainly that testing can be done, but you just need to really think about what the results mean, and they don't mean that you're completely infection free. It only tells you about that point in time.
From Melvin Carlock, WTVA, Mississippi was among the top 12 in mask usage prior to the governor allowing it to expire. Did the governor overestimate people continuing to wear masks when he let the order expire? I'm not sure about the governor, but I certainly did. I've been very disappointed. We had a rough summer, and I really had hoped that people learned the impact of having these public health interventions. The masking, the distancing really showed temporally that it worked quite nicely, and why we would broadly abandon something that's so simple, easy, and effective just because there's not an executive order has perplexed me, and I'm frankly quite disappointed. From Kingfish, obesity and other health problems it causes seem to be the leading underlying pre-existing health conditions. Is the department and governor going to promote an anti-obesity message to lower the COVID-19 risks? Certainly anti-obesity message is fantastic. The challenge is that obesity obviously is something that happens over decades. It's not something that there's any sort of significant improvement that you can achieve in a short period of time. Certainly, healthy weight and lifestyle are something we'll always promote, but probably the timeline for that to be useful would not be effective in fighting coronavirus.
Any of those risk factors, including obesity, that's really the alarm, is that if you fall into one of those categories that are high risk, that you really need to be taking extra precautions.
Kobe Vance from MPB, why do you believe we are seeing the transition back into older populations? Is the majority of that spread of that nursing homes, or is it community spread? I believe it's mostly community spread, and Paul, you can correct me on that, but it's kind of what we saw before, right? It just moves, right? It doesn't stay. If you get it within the people who are 18 to 29, it does not stay confined within that age group. It then disseminates and hits other folks. And I think it's a very similar scenario that we saw over the summer.
And I think, it's probably a mix of both. Certainly, we are starting to see our long-term care outbreaks creeping up now, and that's concerning. But I think it's a mix of community spread as well.
Will the state of Mississippi continue? This is from Nick Juden. Sorry. Will the state of Mississippi continue to adopt successful protective measures and then abandon them once we see improvement? Is there a plan for a long-haul solution? The viral spread that will persist until vaccination is achieved. Yeah, I don't know. I mean, I can tell you what I think would work, and what would work is for us just to take a deep breath and say we're in this for the long haul until we have an effective vaccine widely available. And some of that's going to be moderating our social behaviors, spending more time with nuclear family, doing anything that we do socially outdoors. And then a part of that is wearing a mask in public, especially indoors. And if we would do those things, I mean, this is going to be multiple strategies converging to create success. One strategy is not going to be successful on its own. Even the immunization is not going to be successful on its own, probably. We'll have to see. We'll continue to advocate for those things that seem to be effective, and part of the effort has to be from a foundation from the communities and the population. If we as a people understand how important these are and communicate that up the chain to our leaders and understand what we're willing to do and what we understand is going to work, then there will be a better embrace universally for doing these sorts of things that we know are going to be effective. If we don't say something collectively, the squeaky wheels get all of the airtime. Let's see. Karen Abernathy, WLOX. With this spike as we go into flu season, how concerned are you since we already have ICUs at near capacity in some areas? Sorry, I moved my thing. And what's the harm in a statewide mask mandate that appears to have been working and keeping numbers down while keeping businesses open? Yeah, very worried about the flu and coronavirus coming together. We kind of skated by the skin of our teeth through the summer. As bad as it was, it could have been a lot worse as far as like people not having access to care or not being able to get critical support in the setting of acute illness. So yes, extremely concerned about it. So please get your flu shot. Everybody now before the end of October, everybody needs to have a flu shot. Young, old, sick, not sick. Then what's the harm in a statewide mask mandate? There's a lot of debate on that. I want everybody to wear a mask in public, especially indoors. There were people who were getting tired of the mandate and just sort of violating it when it was still mandated. And I think that was some of the concern, is that it's lost its sort of firepower having a statewide mandate. I think that's a good conversation. I do think, though, that under the mandate, even if individuals sort of strayed, I think the businesses and other groups maintained it as a mode of operation. And I do think it keeps businesses open. And I think we're making a big mistake thinking that masks are anti-business. Masks are pro-business. All right, from CJ Lemaster, WLBT. Our update in testing at the MSDH lab and through private facilities was updated today. For the first time, we've had new numbers in 13 days. Why the delay, and can you talk about how this affects something like R-naught formula, which I believe rely on daily testing numbers to determine community spread? If we're not getting regular testing numbers, we're looking at a moving target that's a week old, or in this case, 13 days old. I'm not sure about the 13-day thing. R-naught is not really dependent on the testing percentage. It's a value that has been used a lot by the White House as an early indicator, and it probably works reasonably well. Other indicators, I think the COVID-like illness, which didn't pop up as early as we did before, but certainly look at cases and hospitalizations, are going to be really two true indicators. We get the batches of total negatives in really lumpy sort of cohorts, and we're planning on doing it weekly. Did it go 13 days, Paul? I thought it was just 7 days.
Yeah, I'm not certain about the 13 days, but every 7 days is what we've moved to weekly. And you're right. There's so much variability in those negatives coming in, and I would be cautious about using testing data and testing numbers to really make any kind of determinations about community spread.
Yeah. To Nick Juden, if the governor directed you, Director Michelle, and Mississippi election officials to set up outdoor stations at every polling location in the state to provide free masks to every voter, could you accomplish that goal by November 3rd? I do think that the Secretary of State has free masks already set to be distributed to every voter coming through. So I don't think, the only thing that would be different, I think, is the outdoor station. We'd have to look at that. I'm not sure. I'm sure we could. Obviously, this is always a matter of resource sort of prioritization, but I suspect we could do that if it were so mandated. But again, since we're already doing it, we'll have to see what the advantage might be if that becomes a request. From Nick Juden, in the process of finding out what the governor is planning to do from an executive perspective at the same press conference as the rest of us, is that the ideal circumstance from a planning scenario? Would better communication help the strategy? I guess you mean for me knowing. I sort of know what he's thinking, obviously, but he makes a deep dive and looks at all the data. And I suspect that from our conversations, there'll be some action that would be similar to what we've seen before, but sort of how that precisely plays out, I do not know just yet.
Dr. Dobbs?
Yes, ma'am.
Okay, this is Liz Charlotte, everyone. I think we're going to close this off at this point. We will try to do these more often as the days go on. And of course, always email me your questions. This recording, we have recorded it, and once it's rendered, it will be on our news and events part of our website. So, and we'll certainly send that out to the public so that they can watch as well. Thank you all for attending, and have a great day.
Thanks, y'all.